Hello, everyone. Welcome back to Healthcare Experience Matters. We are very honored to have a repeat guest on our show today, Shari Gold. She is the Senior Vice President for Regulatory Compliance, as well as the Chief Quality and Equity Officer with Bergen Newbridge Medical Center in Paramus, New Jersey. And today we're talking something very much in her wheelhouse, and that is the intersection of healthcare quality and equity. So, Shari, first of all, if people didn't hear your first episode with us, which we will make sure to link back to in the
Okay.
description of today's podcast, please just introduce yourself and tell us a little bit about the journey that you've taken professionally to get to where we're at today.
So it's great to be back, Casey. I'm so excited to talk about quality and equity. And again, I'm Shari Gold. I've been with Bergen Newbridge since March of 2018. This year, I was promoted to Senior Vice President for Regulatory Compliance, and we added Chief Quality and Equity Officer to my title. And we are, our mantra is quality is priority. It's our important pillar for the medical center. And we added equity to it because we feel they go hand in hand. So my journey in quality started about 27 years ago, where somebody said to me, "Oh, you should go for the total quality manager position. You're good at data and process, and you're very organized." So from there, that's where it all started. And I've worked in many different hospitals along my career. And after taking that position, I became certified in Six Sigma and lean management, as well as pursued my certification in healthcare quality. And also this year, just a few months ago, became certified in health equity, in the foundations of equity and diversity and inclusion. And it's been a passion of mine, and so excited today to talk more about it with you.
And last time we talked on this podcast, you and I had discussed quality measures, and you mentioned that some quality measures were actually quite poor a few years ago. So, what specific changes or strategies have you seen that have made a significant impact in improving these measures?
So, the quality department, we definitely are integral in terms of mentoring, supporting other departments in the medical center. We work with everyone. So the first thing we did was analyze, how these indicators were measuring. And we thought it was very important to go talk to the clinicians and physicians on the importance of the measure and why it's important to them. They need to understand the why. And then we looked at the data and saw where what we call the fallouts, what's not in compliance. And we went back to these end users individually and educated them and said, if you could include this in your process in your practice and include this in your documentation, we'll be in compliance and we will have better outcomes for the patients. And from there, that education, also going out on and doing rounding with checklists and speaking with the employees and the physicians and getting their feedback and making improvements in the electronic medical record to make it easier for documentation and for efficiency. We have seen improvements in the trend month after month, and also sharing how the measures are performing with bulletin boards and graphs and data transparency. So really the philosophy is if you can't see the trends, it's hard to improve. So the staff and the physicians really appreciate this. And we have, again, made tremendous improvements in our measures and our outcomes.
In the context of healthcare equity, what are some key challenges you believe we all still face in the healthcare sector? I mean, how can we begin to address these effectively?
Yeah. So we have come a long way with equity. We've talked about this before, especially with regulatory measures around equity, um, collecting information on sociodemographics and the social determinants or the social drivers of health. So we've come a long way, but we still have challenges in breaking down these barriers around these, measures, and also resources around the social determinants of health. Um, Patients that screen out with food insecurity and transportation needs to get to appointments, and housing insecurity, interpersonal safety, paying the bills. So the resources have improved tremendously over the years too, but we need to keep looking at resources, working with our community partners to make sure that these patients are getting the resources they need. And also, we've made tremendous improvements on decreasing implicit bias and discrimination. That still is out there, but again, a lot of improvements. But what we could recommend is, again, being self-aware, having empathy, using evidence-based tools for screening and assessment, and also order sets so that we don't miss anything for particular patients. Looking at health literacy, making sure that we are assessing the education needs of the patient, having good translation for patients that don't speak the language. One thing in particular we do is we have our medication labels for our outpatient pharmacy printed in the preferred language of the patient, which makes it so much better for compliance, right? Also, these labels are printed in the patient's preferred first name. Another challenge is around using proper pronouns. So we have a lot of education, ongoing education for our staff to use the proper pronouns for patients.
And what advice would you give to healthcare providers who want to contribute to improving quality and equity in their own practices and kind of want to do their part?
So again, like I stated when we started the podcast, is that we've incorporated equity and quality together. So our performance improvement projects all include some equity indicators. We're looking at trends related to race and ethnicity and gender preference. Also looking at the social determinants of health and intertwining that into our projects that we're working on. And it's heightening awareness, keeping it in the forefront, infusing it into everything you do, hardwiring it. We do a lot of education in our manager and director meetings, at our orientation, any opportunity that we have, to keep it into the forefront for our patients, our staff, and also the community, ensuring your human resources policies and your policies around translation and that sort is in order for the medical center. We also were one of the first hospitals in the state of New Jersey and in the country to get the Joint Commission Advanced Certification in Healthcare Equity. We achieved that in January. So that also gives a lot of structure around what is required, and again, keeps things in the forefront around equity for the medical center.
This has been so wonderful, learning so much here. Of course, at the end of the episode, I always like to give you the final word. So, is there any final thoughts or anything else you wanted to mention that we weren't able to get to earlier today?
Quality is everyone's responsibility. Although, it starts at the top with the CEO, and we have an incredible, energetic CEO, Deb Visconti, who is an advocate for quality. She's always talking about how important it is, and she's my partner in ensuring that we, again, lead the way to zero harm every day, and we are always on a journey towards a high reliability organization, and doing everything we can to make that a priority. I say also benchmark with other organizations for best practices, see what other folks are doing and share that information in your organization. Never stop learning. Go to podcasts, books, journals, look at the websites for Joint Commission, Institute for Healthcare Improvement, Equity of Care organizations, the American Hospital Association. And, in quality, it's about, again, working with all of the departments in your medical center, working with your community partners, developing those great relationships. And again, getting out there and supporting the staff and the medical staff, working together and building trust and being those mentoring others will help improve your outcomes.
You've been listening to Shari Gold. She is the Senior Vice President for Regulatory Compliance, as well as the Chief Quality and Equity Officer with Bergen Newbridge Medical Center in Paramus, New Jersey, making her second appearance on our podcast, and just so much to unpack in this interview. And Shari, I cannot thank you enough for your time this morning.
Thank you, Casey. It was great to be here and great to talk about quality and equity, and look forward to doing it again soon.